Well, our first focus on the show today, let's take a look at the latest developments in the UK, where scientists have warned ministers that a third wave of coronavirus may have already begun in Britain, casting doubt on plans in England to lift all lockdown restrictions in 3 weeks' time. Research by Public Health England suggests that the new variant Delta, which is also dominant in parts of India, is highly transmissible and partially resistant to vaccines, has heightened concerns that a third wave could overwhelm the NHS. Well, to talk more about the UK situation as well as the effectiveness of vaccines against variants, we're now joined by Dr. Deepti Gurdasani, a senior lecturer, Queen Mary University of London, and epidemiologist. Thank you so much for joining us on the show. Now, Deepti, there are signs that the UK is in the early stages of a third wave of coronavirus infections, and this could be caused by the Delta variant. What can you tell us?
Sure. I mean, it definitely looks like it's related to the Delta variant, and we are seeing an early rise in cases. It looks like sort of the early exponential rise that we've seen in previous waves. And unfortunately, it's also associated with increase in hospitalizations, which is consistent with the fact that we only have 35% of our population that's fully vaccinated at this point in time. We know that this spread is associated with the Delta variant because it's actually happening in places where the Delta variant became dominant or very frequent early on, so particularly in the Northwest and now in parts of London. But it was sort of localized there early on, but it's now spread widely into the community, and we're seeing spread associated with it in England as well as Scotland.
Right. So, Professor, what do we know about this particular variant? We're studying it here in India, but I wanted to know from you, do we know how much more transmissible it is? Do we know yet whether it does indeed cause more severe illness?
Yeah, I mean, it certainly seems more transmissible. So one of the worrying things is that this variant has grown 2 times as fast as our previous variant, which is the so-called Kent variant, which we already know was highly transmissible. So that variant was 60% transmissible than previous variants, and it now looks like this variant might be 50 to 60% more transmissible than even that variant. And the reason we know that is we're doing studies of people who are contacts of cases of this variant, and we're seeing that the risk of becoming infected if you're a contact of the Delta variant, a case with the Delta variant is 60% higher than if you're a household contact of somebody with our previous variant, which is the so-called Kent variant. The other thing that we're seeing is there's a level of escape with vaccines. So you need 2 doses to be highly protected against this variant with the vaccines that we have here, because 1 dose does not provide sufficient protection. And that's quite concerning, and that's not something we've seen with previous variants. So I think it has those 2 aspects that are really worrying. In terms of severity, we don't have the data on that yet. We're waiting to see that. But it's entirely plausible that variants that are more transmissible can also have more severe disease, which is what we saw with the so-called Kent variant. So I think we have to wait for the data to come before coming to any conclusion. But certainly even what we know now is very concerning.
Right now, so if you could share a little more about vaccines and variants, you touched upon it, but what are we seeing in terms of the new variants and how effective the vaccines are against this? Because this is, of course, very relevant for us here in India.
So what we're seeing with the vaccines here, which are AstraZeneca, which I think is the same as Covishield in India, and Pfizer, is that with 1 dose, the level of protection against disease developing symptoms is much lower. So it goes down from about 50% to 33%. So that's quite low. But with 2 doses, you have much higher level of protection. So with AstraZeneca, which is again the same as Covishield, there's about 60% protection against disease. We expect much higher protection against hospitalizations and deaths. And with Pfizer, it's even higher. It's about 89% against disease. And again, we expect protection against hospitalizations and deaths to be much higher. So I think the message there is, do not assume you're protected with a single dose. If you're offered the second dose, please do take it, because you need that for your full level of protection. But even with 2 doses, although your risk is really, really much lower of dying from this, it is still possible that some people will get really ill and die, unfortunately, although their risk will be much lower. So please take precautions, even if you are vaccinated, because although your risk is lower, it's not zero.
So, talking more about doses of vaccines in India, in fact, we're going to be conducting studies on combinations of vaccines. So far, we do have only 3 vaccines here. The government has announced that we're going to have these sort of studies taking place. What's your view on this?
So I think mixing vaccines is certainly something worth looking at. And the sort of science behind that is that combining 2 different vaccines with 2 different mechanisms can sometimes boost your immune response even higher. And that's what we've seen in some of the combinations that have been studied. But I think the trials need to happen before, we use them in that particular way. Because it could also potentially be associated with a high level of side effects, although we're not seeing serious side effects with that. So if we can boost immunity by combining different vaccines, that's definitely something that's worth doing, particularly with these new variants. I think your second question with respect to a single dose vaccine, it depends on what that vaccine is. So, of course, there are vaccines that are being used with a single dose, but they have a different mechanism and they provide a sufficient immune response with a single dose. Sputnik, Covaxin, and Covishield are not those vaccines. So I certainly wouldn't support a single dose with those vaccines. But if for vaccines like, I think Johnson & Johnson, where single doses are being used, they're based on their mechanism being strong enough to provide that high level of immune response even with a single dose. So that's certainly something that's going to be very useful because we're less dependent on the second dose and compliance with the second dose to receive get to a high level of immunity in the population.
Right, and now there's talk of this new variant which has been found in Vietnam, which is a combination of the variants existing in the UK and in India. If you could tell us about that.
I think this is almost definitely already happening. In fact, in the UK, we have sublineages, which means we have strains of the so-called Delta variant, which already have mutations that are similar to the so-called South Africa variant. And the one that's been detected in Vietnam apparently is a Delta variant, which has some mutations that are similar to the so-called Kent or UK variant. And this is happening. It's very likely happening even in India right now, but we're not detecting these variants because we don't have good surveillance. Because this virus keeps evolving, keeps adapting, and there's no reason it's going to stop. And as it adapts, it's going to adapt to more and more transmission, to more and more escape from vaccines, which is what we're seeing all over the world. And we only detect these things when they lead to large outbreaks in countries. So it's very important we treat this as a global pandemic. And the only way to prevent this virus evolving is to actually stop transmission. Vaccines are a hugely important part of this, but they cannot be used alone without us trying to protect them by keeping transmission down. The problem is with the high level of transmission that we've allowed to happen in India, in Brazil, in the UK, we've kind of evolved new variants that are now threatening the pandemic response even in other parts of the globe, where they had achieved elimination. So Vietnam had 0 cases for very long periods of time. They had a normal life, as did many other countries like Taiwan, where again their response is now being endangered by these new variants. So this is a global pandemic. It has to be treated as a global pandemic. We all have to contain spread, and there has to be equitable vaccine sharing, because in Vietnam, for example, very low proportions of people have received vaccine. There isn't enough vaccine supply, and unless everyone realizes that this pandemic isn't over until everybody has vaccines and everybody has controlled the virus, we are going to be stuck in this for years.
And so finally, do you think the June 21st lifting of the lockdown now seems unlikely?
I don't know whether it's likely or unlikely because I have no faith in government actually following scientific advice, but I really don't think they should move ahead with it. In fact, I think the whole discussion about the 21st June unlocking in the media is a big distraction from the crisis we're in right now. I mean, we're already seeing a rise in hospitalizations and early rise in deaths. We need to be acting now. Even if we don't go ahead with June, it's not that things are going to be okay. They're not going to be okay. We need urgent mitigations in schools where spread is happening. We need good test, trace, isolate systems, and we need to control our borders because, as you say, new variants are evolving all the time, and we don't know what the next variant is going to be, and we need to stop that coming in.
All right, Professor Deepti, thank you so much for speaking to us here at NDTV. Now, the other big focus on the show today, a look at COVID impact on children. While doctors have said that there's no reason that COVID should impact children more in the third wave, what is worrying is that with more people being affected lakhs every single day, the proportion of children impacted has also risen. In fact, in Maharashtra, it said that over 99,000 children have tested positive in the last 2 months, which is a massive jump of 332%. Now, one of the worries with COVID impacting children is cases of multi-system inflammatory syndrome in children, that's MISC. In Andhra Pradesh recently, a rare case has been detected. A newborn was diagnosed with MISC as well as abnormal skin lesions. The 7-day-old newborn was admitted to the Andhra hospital while the child tested negative in the RT-PCR test but did have COVID antibodies in later testing. The baby fortunately is now recovering. Well, to talk more about this, we're now joined about this particular case and about the impact of COVID on children. We're joined by Dr. P.V. Rama Rao, Chief of Children's Services and Director Andhra Hospitals, Vijayawada, Andhra Pradesh. And we're also joined by Dr. Sanjeev Ahuja, Pediatrics Consultant at the Hiranandani Hospital in Mumbai. Thank you so much, doctors, for joining us. And first and foremost, Dr. Rao, if you could tell us about this very disturbing and very unusual case in a newborn, having this MISC, but also having these terrible skin lesions.
Yes, good afternoon. Basically, this is a baby, 7 days old baby, presented with a history of skin lesions over the body. So this baby was seen by other pediatrician on day 1, 16 hours of life, with reddish and some blackish and purple skin lesions. So he said that we'll keep the baby for observation, and then lesions got worse, and then the baby came to our hospital on day 7 of life. So when we saw the baby's skin lesions were quite florid. Mainly on waist and back of the abdomen, buttocks, gluteal region, and ankle soles. So it's a kind of purple blackish lesions with deep necrosis and deep extensive ulceration. So over the back of the buttocks and ankle, leg, and soles. So we thought about the differential diagnosis, what it could be. So the possibilities that would be neonatal purpura fulminans, usually present with this kind of extensive skin lesions in the first few days of life. So that is the one part. But interestingly, what we found, being this is a pandemic, COVID pandemic crisis, we did RT-PCR testing for the baby and mother. Both the tests came back as negative. But interestingly, the antibodies, COVID IgG antibodies to the mother and as well as the baby came back as positive, significantly positive. So what does it mean is there is a transplacental transmission of antibodies from mother to the baby. I know that vertical transmission is quite rare. There are few reported cases are there, but this is the baby who had transplacental transmission of antibodies to the baby as well.
So doctor, did the mother know she had COVID? Was she aware that she had COVID before, when she was pregnant?
No, interestingly, mother was asymptomatic. Mother was telling me that she didn't have any symptoms. But as you know that COVID occurred present asymptomatically without any symptoms. We thought that mother have the COVID and then produced IgG antibodies. That antibodies transferred to the baby through placenta. That's our assessment. And other interesting thing is this baby had very high inflammatory markers. So I'll tell you very briefly. So inflammatory markers that include C-reactive protein, white cell count, IL-6, ferritin, D-dimer, and LDH. These are all inflammatory markers. These are usually raised in multi-system inflammatory syndrome in children. So these markers were quite raised. That is suggestive of multi-system inflammatory syndrome in children. And this baby also presented with fever. So the criteria for diagnosis of multisystem inflammatory syndrome is fever with raised inflammatory markers with the 2 or more systems involvement with the COVID antibodies positive in the baby. So this is a case of neonatal purpura fulminans in combination, in association with the neonatal multisystem inflammatory syndrome in children.
And right now, we're not aware of any other, such case being reported anywhere in the world. And it's very disturbing. You did share pictures with us in a video, but it was just too disturbing to share with our viewers. Dr. Ahuja, I'd like to talk to you also about the impact of COVID on children. While this is fortunately a very rare case that Dr. Rao has had to deal with, recently, it's been announced that in Maharashtra, you've had such a huge number of children being affected. Apparently, in the last 2 months, 99,000 children have been found to be COVID positive, and that's a 332% rise. Is it because we're also testing children a lot more and, the absolute numbers are a lot higher?
Absolutely. So, compared to the first wave, the testing in children has definitely increased, because parents have become more aware that when their child has fever, especially if already somebody in the house has COVID or has fever, they tend to test the child more promptly compared to the first wave, where there was a lot of hesitation in getting the test done. Also, because the number of cases have increased a lot, the parents are being affected in a large number and children also are getting infected. My experience in private practice at Dr. L.H. Hiranandani Hospital, Mumbai, has been that majority of children who come with a result that's COVID positive, they have fairly mild symptoms. They have fever, sometimes a little cough and cold, and majority of them do not require hospitalization, and they can be treated with home isolation. The parents have to be aware of certain danger signs or red flags where they need to contact their pediatrician immediately. Those are mainly fever lasting for over 5 days, difficulty in breathing if the child is lethargic, is not taking feeds properly, especially in children below the age of 1 year, or if there is a rash on the body which is spreading, particularly associated with a red tongue or excoriation of the skin, then those are situations where probably the child has this multiple inflammatory syndrome, which is like a sequelae to COVID that we see usually 2 to 6 weeks after the child has had COVID. Most children, however, as I said, have had mild symptoms, but the huge number of increase of cases in the last 3 months to nearly coming close to 1 lakh cases in Maharashtra in last 3 months, compared to about 67,000 cases in Maharashtra in the last 9 months from March to December 2020.
All right, so that's when you have to watch out for this MISC, and that's the only big worry. But as you said, so, usually in children, we don't get very...
PCR, the COVID test usually comes negative, and the COVID antibodies are positive, and the child presents with fever lasting for over 3 days. Usually there is abdominal pain, vomiting, diarrhea, and there is a marked increase in certain inflammatory markers like the C-reactive protein, the D-dimer level, the serum ferritin level, as well as some changes in the white blood cell count, the platelet count could be seen. So it's a syndrome which is diagnosed on basis of certain clinical features, as well as certain laboratory criteria. And this requires treatment sometimes with IV steroids or immunoglobulin in a tertiary care center.
All right, and this is something that
a large number of cases have had mild symptoms and parents can manage them at home.
Sure, and that is the majority. There are rare cases like this and rare cases like what Dr. Rao that you have dealt with. Dr. Rao, what did the family think when they, first saw this in the baby? They didn't even realize it was anything to do with COVID?
Correct.
They didn't know actually. They thought that initially some kind of skin problem. So that is the reason they come to our hospital. The pediatrician referred to our hospital. Ours is in a tertiary hospital. Because of these progressive spread of these skin lesions. And after that, once we saw the baby, then we did investigate, and after that we found out that this baby had a neonatal purpura fulminans and also neonatal multisystem inflammatory syndrome in children as well. So what we did was we started the treatment. The treatment for neonatal multisystem inflammatory syndrome is immunoglobulins, intravenous immunoglobulins, that is antibodies. And also we treated with steroids and anticoagulation like heparin as well. So this baby needed repeated surgical debridement procedures because you've seen the lesions were so deep and so extensive with the deep ulcers. So we need repeated surgical debridement procedures. Now, right now, baby's condition is a lot better than before. No fever, baby's active, feeding well, and the lesions started healing, and then inflammatory markers are also coming down. So we did extensive literature search about the combination of a neonatal purpura fulminans, this abnormal skin condition with a neonatal MASC. There aren't any reported cases in the world as such. So that is the reason we want to report this case.
And definitely there needs to be more awareness about these issues, especially in children, and what parents need to watch out for. I'm out of time now. Thank you so much, Dr. Rao and Dr. Ahuja, for joining us on the show and talking about these very important issues, especially what parents need to watch out for, and emphasizing that most children have asymptomatic, very mild illnesses, but there are some of those rare cases that you have to be alert about. Well, time for us to slip into a short break. On the other side, we're going to answer some of your questions about vaccines. Stay with us. Now, for our special campaign, Vaccinate India, in partnership with Google, we're discussing questions that you may have about vaccines, questions that you often look up online. To answer those questions, we're joined by Dr. Yatin Mehta, Chairman, Institute of Critical Care and Anesthesiology, Medanta Medicity. Thank you so much, Doctor, for joining us on the show. And one of the questions that people look up a lot is about the safety of vaccines. They ask, are COVID vaccines safe? What would you say?
See, Gargid, all the vaccines which are tried, which are actually released commercially in the market, are fully tested to be safe. So there is absolutely no doubt, because the first test to be done for any medication is safety. So they are very safe. And there was some question about some bleeding risks with low platelet count with certain vaccine. That incidence is, I think, 6 per million or something like that. It is very low.
So all vaccines are safe. And also we get a lot of questions from, diabetics, elderly, those with the heart issues, and also those who are, have some kind of allergies. And they ask about whether vaccines are safe for them.
See, people who are particularly prone to allergic disorders, generally one has to be careful. The vaccine, they should take it tell their doctor, and they should take vaccine in a sort of hospital environment rather than a public place. That's what the advice is. It's not an absolute contraindication that you have some certain allergies. Also, people who are diabetics, who have other immunological disorders, or who are lung disease or heart disease and so on, elderly, they are the group which are more prone for complications of having COVID, particularly getting a severe COVID when they get it. So I think all the more reason that they should be taking vaccine more enthusiastically than the rest of the population, and they should do so the moment they get a chance.
All right, they should push themselves in the front of the line. Well, the other question that people look up a lot are whether there are any side effects of the COVID vaccines.
So they should not push themselves, because one has to be careful about COVID-appropriate behavior. Yeah, so that they should, yeah.
Right, so the side effects of COVID vaccine, that's also something that people look up a lot.
See, most of the side effects are mild fever, general lethargy and body ache. These are common with any vaccine. So there is no big deal to it. The neurological or the thrombocytopenia, the low platelet count and some bleeding, is very, very rare. So in case that happens, obviously one should report to the doctor, but most of the times, ordinary taking crocin or aspirin, the symptoms would go away of body ache and muscle pain and lethargy.
So besides those, just immediately after the vaccine, these, what you feel then, is there anything you need to look out for longer term? If you do have, some sort of other issues, comorbidities, is there anything you need to look out for, a few weeks down the line after you take the vaccines?
No, see, if you get muscle weakness after, say, a week or 10 days or whatever, or if your fever persists after 3-4 days and the body ache persists, then that is the time one should contact your local doctor. Otherwise, I think mostly it goes away in a few days' time. And it may not even happen.
All right, Dr. Mehta, now the process for, getting into that line for the vaccine. There's a registration, and that's what people also look at. How do you register for the COVID vaccine? The process has got fairly simplified now on the CoWIN site, where you go and, you register all your details, and that's something. And there are also walk-ins that have been allowed so that people who are, a little technically challenged, they can get help at the site of the vaccination.
Yes, it is much easier now. And even the CoWIN application the app is not so complicated. It is quite simple. There was a shortage of vaccine. That time it was difficult to get a spot, but now I think it is walk-ins also allowed. So, but yes, you do require, even if for a walk-in, you do require CoWIN on your mobile phone. But it is quite simple, and it is really no problem. My domestics have also got their vaccines done. So it is quite, that's no issue really.
Right, the entire process has been made more simple. That's all you have to do, because this is one of the questions that are asked a lot online, that how does one register for the COVID vaccine? And that is the answer, that you have to go to the CoWIN site and register there with your details. And then, of course, Dr. Yatin Mehta, the process of actually looking for where you can vaccinate it. And that is a separate story altogether, and that takes a little more time. But thank you so much for answering all those questions for us and joining us on the show.
Thank you.